Good evening, everyone. Thank you so much for joining us this evening. We are so excited that you're here tonight. We have a special treat for you. Normally, we don't get to be together, but we're getting to be together and do this Zoom live together. So that's super fun. I'm Nikki McCutchen. I can't say my name either. It's one of those nights, y'all. Anyway, I will be your host this evening. And just before we get started, just know whoever invited you to the call must really care about you to want you to know about this technology. And with that, our medical disclaimer is all LifeWave products are not intended to treat, cure, diagnose any type of disease. If you are pregnant or nursing, please check with your healthcare practitioner first. And with that, we will get started. So tonight I have my sweet friend here, Leslie Watson, with us, and I am so excited for her to tell you her story with this technology. We're going to be talking about the X39 patch. These patches look like this. Sorry, I know it's kind of in a weird spot. You can put them anywhere on your body. Yes, there we go. That's better. But she's going to tell you her story. And so, Leslie, if you just want to start with telling us how you got started and introduced to the technology. And then what you noticed after you started wearing it.
Okay, well, I was introduced to the technology from a patient of mine. And I didn't understand and didn't know what to think about it. So I just studied it. And then I decided this was a good thing to try. And so I tried it and I'm just very nervous. So sorry.
You're doing good. Don't worry, you're good.
And so I tried it. Oh, well, actually, I ordered the patches and I was trying to create figure out what a foundation was for me so I would have a proof, something to look back on later and to take another test or something to look back on later. And the only thing I came up with was a blood test. So I did a blood test before I started taking a full panel blood test before I started using the patches. And then I started using the patches. And then over time, I noticed that my knee pain in my right knee that I'd had for many years, and it was just kind of an ongoing knee pain. It had gone away. And then before I started using the patches, my left knee had just recently started hurting, but it was a different kind of pain. And that pain has gone away. And my right shoulder would hurt all the time because of my job, and that pain had gone away. My hands would hurt randomly just from time to time from my work, but that wasn't an all the time thing, but that's completely stopped now too. Um, I have more endurance. Like I can go through my day without being just wiped out at the end of the day. I'm not having to use as much caffeine. Um, I'm not even I was having like 2 energy drinks a day, so I'm not even having one sometimes, and sometimes most of the time, I'm not even having coffee till, like, on the weekends. And, my, immune system is stronger. I'm not getting sick because I would get sick a lot after COVID. I was supposed to say that. I'm not getting sick as often. Um, my immune system's just stronger and I have more energy, and I don't remember what else I was gonna tell you guys.
Yes. So tell us what you do.
I'm a massage therapist.
Mhm.
I'm a massage therapist for a chiropractor's office, and, it's awesome. I love my patients, and I love my doctor that I work with. Um, I don't know what else to tell you
So
guys.
if you were in the Tulsa area and you're looking for a massage therapist, Leslie is fabulous. So I highly recommend her. You definitely need to go see her and get a massage. So reach out to us. We will definitely connect you. But any of you that have aches and pains because your job is physical like that, there's things going on with you. And so as we age, and especially when we have repetitive motion, so in massage, she's going to have repetitive motion over and over again, to where it was just starting to be, a little bit of a burden.
Oh, yeah, for sure.
Yeah, and this thing that she loves and giving to other people of herself and of her talent, so that she can help them. And yet she's having all these different pains. And so thankfully, she was willing to listen to her patient who brought her this technology to have her look at it, and investigate it. So you did
Yes.
some research first, right?
Yes, I started looking it up the best way I knew how to look it up. I looked at the website and I was kind of looking through the patents, and it was just kind of confusing. I was reading them, really trying to be knowledgeable and scientific, but I wasn't. it wasn't really sinking in. So I started watching YouTube videos. I saw Suzanne Summers, a lot of her videos and how she connected with David. And then I saw David and I'm like, he's the inventor and the owner and the CEO, and he's promoting this product. He's not having somebody else do it. So I was very impressed with that. And so that was another big plus. And so I started with the X39 and the glutathione. I was like, I got to have the glutathione. I knew I needed that for strength in my body. So that's how I started. That's the two I started with. And I started on like the $300 package. And then, yeah, I can't remember how long it was before I wasn't a one patch wonder. And I can't remember how long it was before I noticed things. I have a list of every day when I put the patches on, what time and which patches, because I kept buying more patches. So I could go back and look at a list and kind of tell you, but I did not do that to tell you.
That's okay.
But I will tell you this. I was at a place a couple of months ago where I ran out of X39 and I had given some to a friend and then I didn't get it reordered. And so I was without it for about 6 weeks. In that time, I would start having random knee and shoulder pain again. So it was just a confirmation that I was doing the right thing. I was supposed to be doing the patches. And I got back on my regimen kind of, and I just wanted to tell everybody, don't stop.
Yeah.
Keep taking them because it made a difference. I could tell.
So how long have you been on the patches total?
A little over a year. I started August 1st last year, so a little over a year.
Okay.
Mhm.
And then when you had stopped, when was that in that time period?
That was earlier. That was probably about 2 months ago. So I was
Okay.
well over my year when I stopped, but I just stopped that one. I was still had extra other patches. I'm like, well, I'm gonna wear the other patches until I get these others, but I just kept not getting it done, not getting the order placed.
Yeah. Yes.
Disobedience.
Well, and I just think it's a good reminder because I know we haven't talked about X39 yet. I haven't explained it to you, but the X39 activates dormant stem cells. So by the time you're 30, half of your stem cells go dormant. By the time you're 60, you only have 10% of your stem cells any longer active. And so when that happens, our body just naturally ages in that way. And so here we start using this product that's activating those dormant stem cells. And so how long were you off of the X39?
I was about 6 weeks total without that one.
Okay. So your body just won't automatically go back to, the way that it was before, but 6 weeks off, what happens is your body just naturally starts down that aging process again. So a lot of times people ask me, well, is this something that I have to be on forever? Well, ultimately, if you don't want to continue to age, yes, you probably want to stay on it forever. I know I don't ever want to go off because that's just how our bodies naturally age. That's what's going to happen. So 6 weeks amount of time. Do you mind if I asked how many years young you are?
I am 42. No, I'm lying. I'm 62.
62?
I'm 62.
I believed you at 42. I did too. I heard her answer.
And I just told the whole world. Oh my gosh. My children even know how old I am now. Oh my gosh. They thought I was 42 as well.
Well, we're just gonna stick with that because guess what? Now the blood test that you did it?
That's what I.
Oh yes. Okay, so tell us about that.
I didn't go back and get one done.
Oh, okay.
I'm saving to do that. But I didn't, when I had the blood test done, I didn't even have it read. I didn't have the doctor look at it. I just said, I just need this for a foundation. You don't have to tell me anything about it unless there's something wrong. So I didn't even have anything. I haven't, so I have to compare and tell you, maybe put the results if
that would be awesome. That's good. That would be awesome. So what's so interesting is there are some people who do their biologic age test who are, I know people that are 50 who now their blood work shows that they're 25. So it truly is a product because we're activating dormant stem cells that's truly an age reversal. It's not just anti-aging. And so obviously Leslie looks amazing to be 62. I would have never guessed. I for sure would have thought we were the same age. So there's no I'm 50. So there's no way I would have thought she was 62. That's amazing. Oh my gosh.
So funny.
Okay, so
Uh-huh.
you wore X39 and
Yes.
glutathione right off the bat.
Yes.
And then when did you start adding other
As
patches?
soon as I had the money, I
Okay.
just was so impressed with the technology and so impressed with the business opportunity. I have been in a lot of different direct sales market, multi-level marketing things in my past, and I believe in them. But this one, even knowing it was a binary and knowing a little bit about that, and knowing how they were teaching people, even these other teams that we can see online, they were teaching people how to structure and how to build outside right and outside left. And then you're not having all these people in the middle that end up without someone to help them. So everybody's helping everybody, no matter if they're below you or above you, everybody's helping everybody. And I just love that. And then I hope this is okay to say. But then I started meeting some of the people or watching some of the videos, and they all love Jesus. Even better, so I'm just like, it was just a win-win. It
Yeah.
was just awesome.
Absolutely.
Yeah.
Yes. Yeah. So what
Mhm.
made you decide that glutathione was one that you wanted to start with?
Because I had had a yucky thing happen to me in 2020, and my immune system was just every time a patient would come to my table and they weren't all the way well, I would almost always get it.
Mhm.
And then that keeps me from being able to be with somebody else because I don't want to pass along something. So my immune system was just, I could tell it was really low, and I knew I needed to strengthen my immune system.
Yeah,
So,
absolutely.
yeah.
Yeah, so the glutathione isn't one that we're going to focus on tonight, but just so you know, it elevates your glutathione levels in your body by 300 times. So there's no liposomal glutathione that you can take or even IV glutathione that will do that very same thing. Glutathione in the body has a 7-minute half-life, which means it starts to dissipate after 7 minutes. And so it's why David Schmidt always would recommend precursors to glutathione. So taking NAC as a precursor to glutathione to help build the glutathione in your body. But our patches are far superior to that because anytime you can support your own body's natural processes and help your body do what it was designed to do, then you have the maximum results with that. And so that's why our technology is so far superior because it's completely non-transdermal. It's all operating through infrared light. I guess I'll just go into that. If any of you
Yes,
guys, if I
please.
forgot to ask
Mhm.
some questions you want to know, type those in the chat or I'll have you come on afterwards here. But basically how our technology works is it's completely non-transdermal. The patch is sealed on both sides. So there's nothing transferring from the patch into your body. It all operates through light. So our bodies emit a low-grade infrared light. How you know this is a process called photobiomodulation. That's just a big word for light making change in the body. And this is what happens when you step out into the sun and the sun hits your skin and your eyes, and it tells your body that the vitamin D in your body needs to get up and working the way that God designed it. And so that's what happens with this patch. It's made up of a crystal lattice structure that's reflective. That reflective structure that our infrared light hits that bounces back into our body at a specific frequency, turning on different peptides. So the X39 turns on GHK copper peptide. If you Google that, it is going to come up with a long list of things that GHK copper peptide supports in the body. So one of those things is activate the dormant stem cells, like we talked about. Another one is that it supports your cardiovascular system, every part of your cardiovascular system at the mitochondrial level. So your heart, your blood vessels, the lining of your blood vessels. So I see people all the time that have blood pressure issues that then have positive results because this technology is supporting your cardiovascular system. It supports your immune system. So even though Leslie was choosing to use the glutathione to also help her immune system, the X39 also boosts her immune system. So anytime you're using multiple of our technologies that we have, different patches that we have, just know that even though like they may both support the immune system, our immune system needs multiple areas of support for it to work properly. So GHK is supporting the immune system differently than the glutathione. So they're working synergistically then to give us maximum benefit in what's going on with our immune system. Another thing that it does is remodel scar tissue, helps with wound healing. So any type of surgery, it helps with, if you're having that, it can help that scar heal up faster. Now, Leslie wasn't talking about surgeries, but she was talking about how even like her knees. So the X39 reduces inflammation by 30%. So GHK copper peptide actually helps to reduce inflammation in the body as well. So her issues with her knees, her issues with her shoulders, those were all being supported just by GHK. So anytime we have inflammation in the body, it creates problems. So she was having multiple different joint issues, her wrists that were going on. And so just with that, that inflammation was reduced so she could continue to do what God had called her to and work on these people and just bless them with her skills. And so that was amazing that for her to help in that way. Trying to think. I think I got, did I miss any? Trying to remember. I didn't I didn't grab my list tonight. Yeah, cardiovascular system, immune system, stem cells. And anyway, if you look up GHK, it's a lot longer than that. It helps with brain fog. So that was it. Brain, depression, anxiety, those all start to lift. You start to be able to think clearer about 6 weeks into utilizing the technology. So I think I said before, 1 month for every decade you are old is the recommendation. Hydration is key. So we need hydration for our cells to talk to each other in any type of health that we have, any type of benefit that we're going to have with health. It takes hydration for you to have that energy, the ATP, so your cells can talk to each other and communicate and send those signals so your body can do what it's designed to do. So the hydration will help just with the patch technology to work as well. So let me see. Let me pull up the chat. Do y'all have any questions? Let me see if there's questions in the chat. Let me see. Oh, auto ship. Yes. So Vicky was saying, yes, our resident patchologist was reminding us that auto ship is a good idea. So we'll never be without our patches. Yes. So that's huge for sure. And obviously she's saying you look amazing, and she never would have thought, yes, that as well.
Thank you, Vicky.
Yes, you look, it's just so Vicky's saying you look younger than her.
I don't.
Oh my gosh,
You
that's
do.
awesome. That's so funny. Oh my goodness. Okay, so if anybody has a question, make sure
Question.
that I got everything. Yes.
You said you used glutathione and X39
Hmm?
and no other patches, like you haven't tried any other ones yet?
No, I have. I've tried them all except for Silent Nights and the horse one, which I've been tempted if I was ever out of Ice Wave. I'm like, I'd probably go get the horse one. I just have to be honest, I would. But anyway, I have not tried Silent Nights, and I think there was one called Nirvana that has been out, but I haven't tried that one. But I've tried all of them, and if I have them, I wear them. But I don't wear the energy enhancer every day. I did wear the energy enhancer every day for a while, but I've realized I don't have to wear it every day to have the sustained energy anymore. So I wear it usually on my long days, or the days I'm seeing the most people, just to ensure that I have the energy. But I mean, I've used all of them.
Yeah. So just so you know, for those of you that have pets, we have a patch called AccuLife. So yeah, so that's what she's talking about for horses. So it actually can be used on any type of pet, but it is actually the exact same thing as IceWave. It's just in order to be licensed properly, for us to be able to use something on pets, we have to have one that's licensed for pets. And so that's the AccuLife, but it's actually exactly the same as IceWave. IceWave is our pain patch that just breaks a pain frequency. So anybody that has a lot of pain, it's a great ad. That's one of the products we have. So
Yeah,
yeah.
and it works great.
Okay.
I'm
I
sorry.
Thank you.
Did you say you tried all the other patches except for the Silent Night one?
Yes, I had not tried Silent Night.
Okay.
But
And
I
then
don't
did
have
you do
trouble
any of the
sleeping.
detoxes too? You just
I didn't know about Patch the Ways, your different protocols that you had for a long, long time. And then I was already doing the patches, so I didn't I didn't learn about that. But I forgot what I was gonna tell you.
That's okay.
That, I don't remember what I was gonna tell you. Something about, I didn't do it. I didn't do any of the protocols. Sorry, guys.
Yeah, no, you're good.
No detoxes.
Yeah, the
No, I didn't
detoxes.
have, I don't think I really had any kind of a detox.
Mhm.
No, I don't think I did.
Yeah.
I don't think so.
Yeah.
Thank you.
So
Thank you for sharing your testimony with us.
You're so sweet. You're
It's a lot
welcome.
of benefits. It's a lot of benefits, and I can't wait to hear
Yes.
6 months from now.
yes.
Oh, gosh.
Yeah.
Wow.
Yes, I mean, when you have joint pain and issues, I mean, that's a lot, and it's a lot of different places of the
Yeah.
body that were affecting your daily, your
Mhm.
work, your life, what you love to do, what you were called to do. So,
It was
very
very
important.
scary for
yeah,
your knees, because the last knee, it was a different kind of pain, and it was causing me to limp. So,
Mm.
and other people were asking what's wrong, and I'm like, I work with a chiropractor who's adjusting you, my chiropractor, but it wasn't that. I just knew that there was something I needed to support, so
Yeah.
I
Yeah.
needed to change something.
Yes, and that's
So,
awesome.
mhm.
And that's what's so cool about this technology too, is that we don't have to know exactly what's going on because our bodies are created fearfully and wonderfully made. And so when we support it the way that it's designed, then it gives it the support that it needs. So whatever was causing that limp, that sent those stem cells there, sent the anti-inflammation reduction so that she didn't have the limp
Yeah.
anymore and didn't have pain. And yes, Diane, thank you so much. I did forget to say, so how you wear them is 12 hours on, 12 hours off. So 12 hours on to activate and repair, 12 hours off to give your body a break. Because what happens is with any type of red light therapy product, it's signaling your body through frequency and telling different peptides or your mitochondria to get up and get working and do what it was designed to do. Your body can't sustain that kind of energy and that kind of load and signaling to keep working. And so that 12 hours off allows your body to rest so that then the next day, when you put on a brand new patch, then your body can start to get working again. So I put mine on in the morning when I get up, I take it off at night when I go to bed. The next day I put on a brand new patch. So thank you for that reminder, Diane, because yes, I needed that.
You guys, I will say too, I thought one more, that's what I
Good.
thought of Vicky, that I was gonna tell you when you asked about silent nights. I didn't know, I've never had trouble sleeping, but I never have liked getting up early in the morning. I can make myself get up early in the morning, but I won't get up all by myself. I'll have to snooze, but that stopped. I wake up after 8 hours of sleep and I'm rested and I'm ready to go. So I want to tell you that too.
Yeah,
So it
that's
didn't
huge.
change my sleeping, but I just sleep more soundly and I'm ready to go after, my body's ready to go after 8 hours.
And are you dreaming at all? Did you
Yes,
dream
I
before?
am dreaming. I didn't dream as much before as I'm dreaming now. And I think I notice more dreaming when I have an Alavita patch on. And sometimes when I put it right here or right here, I notice more.
Mhm.
So,
Yeah.
yeah,
Yeah,
but
so
not
it's
always.
right,
Mhm.
which is allowing us to get in that deeper sleep. I know I pretty much had stopped dreaming before I started using the patches again. And now I feel like I remember like I've been dreaming every night, like there's something going on, but yes, yes, I'm dreaming about something. But you just know that it's taking you back in those states when you were younger and your body was at a healthier state.
Yeah.
And so it's doing whatever it needs to do to rejuvenate. And I just think it's amazing that the X39 does help so many people with sleep to where you're
Yes.
just getting that restful state
Yeah.
to where when you wake up, then you do feel like, okay, I can totally go. And the sustained energy is really good too.
It
So,
is so
yeah,
remarkable.
the energy with the X39 was huge for me. That I don't notice an energy boost with the energy enhancer. I know some people do. But the X39 totally did it for me for sure. Now I do, like you were saying, if I have to drive a long distance, I wear the energy enhancer and I don't feel like I need to, close my eyes or sleep or whatever. I have, yeah, so that's super helpful. And of course I wear the energy enhancer every day because I want the extra 300 to 600 calorie burn.
Yes,
So
me too.
it turns on
too.
beta oxidation,
Me too.
which turns its body fat into fuel. So I'm like, sign me up for that. I
Sign me
definitely
up.
want
Sign
that
me
one.
up.
Me too.
Yes, that's
Me too.
exactly right. Yes. Let's see. I love the way you explain the way the patches work, Vicky. Yes, Vicky, you do such a great job. Um, Oh, and your customers. So Diane, your customers are telling you about them dreaming too. Yeah. Isn't it so exciting when we can help other people, that we have something to offer them when there's things going on with them. And like we were talking about, we don't have to know. We don't have to know what's going on. We don't have to know how to fix it. We can just say, this technology is amazing. You should try this. And that's really, all this is about is because we care about people and we want them to know that there are options out there for their health, and things that can support their body naturally, because that's really what, to support our natural design is so important. So anybody else want to come on? Do you have a question for Leslie, or any other comments?
You did great, Leslie.
Oh, you're so nice, Pastor Ed. Thank you so much.
You're welcome. Love hearing your story.
Yes,
Thank
it's so
you
great,
for letting me, encouraging me to do it.
Yeah, it's always so important for us to share, because all of us are different, and our bodies are different. And so the technology is going to support us in different ways. So Larry, did you have a comment?
Yes, Leslie, and Nikki, you guys did great again, but, nice to meet you, Leslie.
Thank you,
Leslie,
Larry.
have you introduced it to your client base?
Yes, I do that gently at the right time. My chiropractor that I work for, he is also a distributor and he promotes the product. So we kind of have a system where we work together and share it with our patients. So that's really, really awesome. I'm very thankful that he chose to use the technology too. It's a big blessing, big blessing. Yeah.
Isn't that so cool? I love that so much. Like, to have an office environment where you're working together. And so you're doing these great modalities for health. And then you have this technology that you can enter that not only are you helping and treating someone on that daily basis, or weekly basis, and then you have something that you can send them home with to then say, if you have issues or pain, or you want to get your stem cells regenerated, they can be sent home with daily help. So I love it so much. So it's just that compounding effect of just being able to help more and more people, and us working together as a team, and just being able to support people. And it's so cool when you can get an office that is all working together in the same direction and using multiple health modalities. I love it so much. So
Me too.
yes, it's so
amazing.
cool. Yes. No, Diane, you cracked me up. No problem. She kept saying Vicky. Sorry. And Nikki. Nikki. Hey, we'll both take it, right, Vicky? I love Vicky. She loves me. We'll just go, yes, that sounds good.
Yeah, I
That's
love the
awesome.
path too. I love the path too, but I meant to say, Nikki, I'm so sorry. You ladies did a great job.
Oh, so
so good. Yes.
Appreciate
Thank
your
you all so
testimony.
much. Yes. Thank you all so much for joining us tonight. So please, whoever invited you to this call, please get back to them and tell them you want to get started with this technology today. Let's get you on a road, a journey of healing, and just working with all of these wonderful people who want to benefit you and support you in your health journey. So thank you all so much for joining us tonight. We pray blessing over each and every one of you. Good night, everyone.
Bye.
Good night. God bless.
Good night.
Bless.
Good night.
Good night, everyone.
Good night.
Great